We don't know the risk of catching COVID-19 from feces, but the Dargat's mink ranch's manure shed could provide insight. The farm was quarantined on January 15th in response to a COVID outbreak amongst the mink. For a disease to transmit via fecal matter or food, it must be able to replicate in the gut, survive outside a host in the environment, have a low infective dose, and be able to survive the gastrointestinal tract.
We found a lot of evidences that the SARS-CoV-2 might have these four characteristics, and we can't see anything that prevents this virus from being a foodborne virus. The only issue that we don't have studies so far to confirm this or to associate certain cases with consumption of contaminated foods.
Reasons to consider non-respiratory transmission is the virus's effect on the gastrointestinal tract, including diarrhea and loss of appetite. Also, SARS-CoV-2's ability to replicate in the gastrointestinal tract, or GIT. Respiratory transmission of SARS-CoV-2 is an established fact. We get the virus through the air. And it is possible for a respiratory illness to affect the GIT.
It could come from the lungs through the blood vessels, and then you get viral infection within your gut tissue. And that could lead to the inflammation that we sometimes see with COVID infection, so the diarrhea and the other GI symptoms, just by having the viral infection present in the tissue.
There's still much to learn about COVID-19, starting with where and how the virus crossed from animals to humans. Scientists are still looking for a bat with SARS-CoV-2, but have yet to confirm the individual source of the virus and the point of transmission to humans. Fortunately, we do have some experience with zoonotic diseases.
The majority of zoonotic diseases that we potentially could catch from our animals are fecal-oriented. So as long as you wash your hands before you put your hands in your mouth, you should not ever get the disease.
Washing hands has been advised by public health authorities since day one to prevent the spread of COVID. But if it's possible for SARS-CoV-2 to spread through food or fecal matter, and we still have not investigated this potentiality, we cannot say we understand it.
And this is, this is something that shows the high need for these kinds of research.
Emma Gregory with the Langara Voice.